Assalamu alaikum. My name is Dr. Abdul Jabbar Aden, and I'm part of the SOMPA committee that is organizing this medical camp. SOMPA is Somali Medical Professionals Association. We're here conducting a medical camp that is mainly focused on cardiovascular and oncology screening. I've had the pleasure of meeting with Dr. Mariam, who's a consultant radiologist. Doc, karibu.
Thank you.
Kindly introduce yourself, where you work, and what is your specialty?
So as you've heard before, my name is Dr. Mariam Omar. I'm a consultant radiologist. I currently work at Jalaram, and I have interest in women imaging and women cancer.
Okay, thank you very much. So what can you tell us about your experiences with breast cancer, since you get a lot of referral for patients who you do ultrasounds for? Yes. What is your experience?
So just a brief history first about breast cancer. So breast cancer is a cancer of the breast. And in the West, this is something that affects postmenopausal women, meaning women after their periods has ceased to be. But in our setup, we are noticing that younger patients are being diagnosed with breast cancer. And when I say younger, I mean below 40 years. So that is something of concern that we've noticed of late.
Has that sparked your interest in trying to advocate for early screening for breast cancer in the community?
Yes. So the current guidelines, according to what we use from the West, is screening should start at the age of 40 because their cancers start after postmenopausal, which is after 60 years or something. So for us, because our cancers start a bit earlier, we are trying to see if we can do breast ultrasound instead, rather than a mammogram, for screening for patients younger than 40 years.
So in your experience, do you have what trends are breast cancer trends in the Somali population? Is it the same trend that you're seeing in other Kenyan populations, or it's distinct in Somali population?
So the thing about Somali population is our cancers, we usually diagnose it a bit later.
Yes.
I think because, I don't know if it's the stigma involved or not seeking medical attention very early enough, but we are noticing that we are getting it a bit later when it has already spread, mainly to the lymph nodes or even outside the breast.
Okay, thank you so much.